We realized that time-lapse is a tool to assist with clinical IVF. It's new and got all this promise. But as with any new technology, we need to be careful how we implement it, when we implement it. But at the same time, we can forget or miss some great opportunities, how this tool can help us, providing unique opportunities to provide laboratory performance, and that will be the emphasis of this talk. Now, when we talk about quality management, I don't want you to read it all. I want you to realize that quality management is intricate, composed of several different components. And I want to talk a little bit, just touch quality control, and then we're going to concentrate on quality assurance, which I think is the more interesting part of applying time-lapse technology. Now, we need to realize time-lapse systems are unique, and not to get into too much detail, but from a quality control point of view, we must give special attention to temperature. Some of these systems, the non-proven ones, may be not stable in terms of temperature. Gas concentrations, we need to make sure that we provide the best quality gas even for these systems. With a lack of resilience of safety margin, we need to make sure that the alarm systems is really sharp, no delays, and that we have adequate backup systems. I don't want you to bore you with that. Furthermore, from a quality assurance point of view, it's easy to see this as freestanding systems and forget that it's actually part of our overall in vitro fertilization laboratory. So just a reminder that we should treat it exactly the same as anything else. Give some thought in terms of which materials are unique to time-lapse and put it through the same tests as what we would put everything else in our laboratory. And then with our desire to culture uninterrupted, it's already been talked some about that, to culture uninterrupted up to 6 days, it poses unique challenges to culture media, which I will talk about a little bit on the next slide. This is just a quick flow diagram of a 5-day sperm survival assay, and showing that just as we're looking at everything else in the lab, we also need to look at unique supplies specific to time-lapse, such as the culture dishes, hold it to the same standard, and make sure that based on the criteria in your laboratory, it also passes your quality control and your quality assurance. So with a desire to culture embryos for 6 days and to get the proper benefit from uninterrupted culture, we want to use a one-step medium, one of the things that we want to do. And with that, we have unique challenges in terms of ammonia buildup, which one of the common causes is ammonia coming from the amino acids. This is a picture of an amino acid molecule showing the ammonia molecules and then the ammonium coming off that. One way to stabilize the culture media is to make use of dipeptide form of an amino acid, which is much more stable because of the peptide bond, and provides for a much more stable culture medium. Looking at this slide, it's showing the effect of our choice on culture media and specific protein supplements. On the left here is the ammonium concentration, and here is the days of incubation. This slide is not taking into account the production of ammonia by embryos, only of the culture media. Based on study of literature, and for the purpose of this slide, I decided on about a 75 micromolar level as a potential toxic level for ammonia in the culture media. So when we look at a specific time-lapse designed media, you can see that we're quite safe, stay quite low. Now when we look at a sequential culture media, the blue line, ammonia starting to build up, changing it out, dropping and starting to build up again. The green line is looking at a media that was not specifically designed for time-lapse, and the ammonia gradually building up, sort of approaching the toxic level, but not there yet. Now, once we start messing with these pre-designed culture media and we start adding protein sources from outside without thinking through that or thinking through the consequences, we can get in trouble. So here is now the two purple lines up here are media not specifically designed for time-lapse, kept into incubation for 6 days, And then on top of that, adding additional protein, and you can see it's not that hard for us to get in trouble getting over the toxic level quite quickly. So this is all without embryos. Now once we start adding embryos, it's going to even change this further. This again is looking at ammonium concentration on the left, time of incubation. The dotted line is media, time-lapse or sequential culture media without embryos, and then we add the embryos to these, which is the solid line. And as a general rule, you can see once you add embryos, regardless of what type of media you're using, you can roughly count on a doubling of the ammonium concentration. So it's going to take much less. If you choose an inappropriate medium to start off with, then in this semi-group culture conditions, add your embryos, you're running a significant and a real risk to get into the toxic range of ammonia in your culture medium. So enough about risks. Let's look, I think the more exciting part is looking at the opportunities. And we've heard quite a bit from Marcus and from Steve in terms of dynamic morphology. I'm not going to say too much about that. I do want to talk about objective time-lapse standards, how to establish that, how to use time-lapse, great opportunity to use it as an objective early warning system, how to use it as a measurement tool to identify sources of variation. I think that's very important from the safety of the laboratory, and how to use it as a tool to evaluate any introduction of new technology, procedures, or products. Dynamic morphology, let's not spend too much time on that. It's already been discussed. How to use a time-lapse system as an early warning system. Now, a lot of labs, a lot of programs, their definition of an early warning system is let's look at pregnancy rates. Now, pregnancy rates is a terrible early warning system. Number one, it's not really an early warning system. It's a consequence of things that's not going well once pregnancy rates going down. It's confounded because it's not looking strictly at lab effect. It's looking at patients. It's looking at the clinical side and lab. And thirdly, the experimental unit is a patient. Therefore, we need lots and lots of patients before we're going to see an effect. So without time-lapse, a better way to look is change the experimental unit. Instead of a patient, let's change it to an embryo or a fertilized oocyte. And now our statistical power is much higher, like in this case. So here we were comparing two insemination medium, medium 1, medium 2, and using then the oocyte or the fertilized embryo as the experimental unit. We have much increased power, and even with a small change in cleavage rate, we could tell that medium 1 was by far superior than medium 2, or even that there was something wrong with medium 2. It was not performing well in our system. Now, with time-lapse, we can actually do much better than that. We can even improve this. So what we can do is we can pick two or more targeted time periods, like in this case, T5 or T8. And my experimental unit now, instead of an embryo, is actually multiple time points for a specific embryo. So statistically, it drastically even further increased my power in terms of detecting a problem. So even with smaller numbers of embryos, or patients for that matter, I can now start detecting differences or insufficiencies in the system. So in this case, T5 and T8 need to be specific to the culture condition and the culture environment. Note that in our case, in our laboratory, we had to have a different criteria or a time limit for fresh embryos versus frozen embryos. Definitely seems like frozen thawed embryos is delayed a little bit more than fresh. But with this, we can determine detrimental effects or compromises much, much earlier with as little as 10 or 20 patients in a group. In addition to this, if you really want to get into it, we can use advanced formulas and looking at specific cell metabolism events or cell function events. Just some examples here, like cleavage synchronicity between multiple cell cycles, cleavage synchronicity within one cell cycle. We can look at things like DNA replication, time ratios, and growth rates. For instance, blastocyst expansion rate can all be used, and under certain circumstances, these can be very valuable, targeted, very specific, cell-specific events that can be used for us to pick up specific problems. Identifying sources of variation. When we have something going wrong in the lab, it's this big black box and we don't know where to touch. But if you really think about it, when pregnancy rates drop, it's always going to be only one of three things. It's fairly simple. It's either the patient, it's on the clinical side, or if it's the lab. Sometimes we spend a lot of time trying to find out what it is, but there's also a lot of power determining what it is not. And if we can just determine it is in this category, or for this matter, if we can only rule out patients or the clinical part, it's going to help us to zoom in on the real problem. How do we do that? First thing we need to do is pick a very sensitive time point. As you will appreciate from some of the following slides, T5 is not a bad criterion. So let's take T5, then we establish a normal distribution curve for our patients, for our culture conditions. Once we have this normal distribution curve, we can now use targeted comparisons of different distribution curves between specific groups of interest. And now by comparing different groups of interest, like two different groups of patients, two different physicians, two different stimulation protocols, or when we look into laboratory criteria, time periods, very important, or different time periods of using different consumables, we can fairly clearly see if there's a difference in the distribution curves, high statistical power, if we have a problem in a certain area. In addition, we can identify a specific patient. If a specific patient is outside of this normal distribution curve, we can easily assign the problem to that patient and not necessarily to the laboratory and end up changing the culture media or anything like that drastically. When we introduce a new culture condition or a new technique or a new consumable, time-lapse is invaluable in terms of being able to determine that. Here's a great example of starting low oxygen culture. And what is the effect of that? So the goal here is not necessarily to see if it's better or worse, but to see if it has an effect on the status quo in our laboratory or in a laboratory. So in this case, we're looking at the time-lapse time on the left here. We're looking at incubation time. Red is regular atmospheric oxygen. The blue is culturing in atmospheric oxygen up till day 3 and then going to low oxygen, day 3 to day 5. And then green is what we would always propose and recommend, is low oxygen culture right out. T5 to T8 is the critical period. It seems to come up as a pattern when looking at time-lapse data. Note that before day 5, we don't see any difference. T5, we don't see any differences. After T8, we don't see any differences. And we can see statistically significant differenses between this critical time period of T5 to T8, a beautiful graduated response with the green line, the low oxygen culture, clearly giving us the best outcome. One more example. If we look at different techniques, this is looking at slow freezing versus vitrification. Typically, a lot of programs did great with slow freezing of pronuclear embryos. Is it really worth it to even vitrify two pronuclear embryos? I'm not going to answer that question, but look at the data. Again, look at the pattern. T5, T8. Before T5, we don't see it. After T8, we don't see it. And we see a clear difference between these two techniques, between T5 and T8. One of the reasons we like to pick somewhere between T5 to T8 to zoom in if we're looking at differences from a quality management point of view. In conclusion, time-lapse is not only for the selection and culture of better embryos, as the two speakers before me have discussed in detail, but we're missing out if we're not also implementing it as a quality management tool. Just for that, time-lapse is already a great motivation to have that in our laboratory. Yes, it can be used for dynamic morphological observations, not only forward in terms of prediction, but also backwards in terms of quality management. But it can definitely serve as a very, very sensitive early warning system of impending laboratory failure. If anything, you can actually catch it even before it affects your patients or your pregnancy rate. It definitely can discriminate between sources of variation, as an example, between a poor performing patient and a real problem in the laboratory. Remember, change is our enemy. And just as much as we want to make a timely change, we also do not want to make a change if it's not clearly indicated. And it's a great tool for the objective evaluation of the introduction of new supplies, media, or a technique. And lastly, time-lapse has the potential to become a standard quality management tool as long as we do it under predefined culture conditions in our laboratory for our patient population. It definitely can reduce observational variance between embryologists. It will be consistent over time, and it's guaranteed to increase the power of determination of isolating problems due to multiple observation points per embryo. And with that, thank you, Mr. Chairman.